Welcome to the Modern Wellness Podcast. I'm your host, Dr. Pardee. This podcast, along with my private practice in LA and my newsletter, all are aimed to providing you evidence-based information around preventative medicine, longevity, and health in general. Join me in dispelling health myths as well as cutting through the noise that is social media. I hope that whether you want to optimize your performance or just in general get healthier, the Modern Wellness Podcast will help you do that. Today, I am joined by Dr. Matthew Nagra. He's a naturopathic doctor devoted to bringing the most up-to-date, evidence-based nutrition information to his patients in his Vancouver-based practice and to the public through social media, public presentations, and scientific publications. He makes the latest nutrition science easily digestible and corrects misinformation, empowering people to make informed health choices. He's also a nutrition science advisor for the highly anticipated documentary, The Game Changers 2. Thank you for joining us. Let's begin. I'm excited for today. I'm excited to chat about how we both got to naturopathic medicine. I'm really interested in your story. I've been following you on Instagram, and I think I've reached out a couple times where I'm like, wow, I really resonate with all the content you're putting out. It's so evidence-based, and I think that we have that in naturopathic medicine, but I think there's sometimes people that are outside of that evidence-based piece. And so I wanted to connect with you and chat about your thoughts around it as well.
Yeah, thanks for having me on. And it's a little bit of a different sort of conversation than I'm used to, so that's refreshing. Um, and yeah, as far as how I first, I guess, started down this path, when I was younger, say teens, late childhood through my early teens, I I struggled with some health issues. I had asthma that was quite serious at one point. I struggled with my weight despite playing every sport imaginable. Um, I tried a lot of things. I was 12 years old. I remember trying the Atkins diet. Like that's the sort of length I went to even at that age. And I had a personal trainer who really promoted more of a sort of plant-based diet, not 100%, but mostly. And so it was through his influence that I eventually started making some dietary changes. I was resistant at first, but once he wanted me to record a food diary, I was like, oh my God, he's going to see how bad my diet is. So I'm going to try to eat in accordance with his recommendations, which maybe wasn't super representative of what I normally ate, but I did that and I started noticing right away my skin was clearing up, I was losing some weight, breathing easier even, and it was from that I thought, well, okay, maybe there's more to this nutrition piece than I otherwise believed, and especially as a kid, I mean, who really thinks about it? Um, and so over the course of the next few years, I started reading up more, and I turned to a lot of the types of sources that I think many of your listeners probably do, and a lot of people that follow me do. Social media wasn't necessarily around or as big, but books, blogs, that sort of thing, YouTube to a degree. And that's what first sort of sent me down that plant-based rabbit hole to a degree. But at the time, the raw vegan fad was a lot bigger, or the raw food
Mm-hmm.
fad was a lot bigger. And so that's actually kind of my first birth into really plant-based eating. Now, over the years, as I went into university, I was very interested in nutrition. I majored in microbiology, but I also took some nutrition courses and started learning more there. And then it was around my third year in one of my health science classes that was related to the nutrition piece. My instructor actually suggested that I maybe shadow one of her naturopathic doctors. There was actually a couple that owned and ran a clinic, and they both practiced very differently. So I thought, okay, that's interesting because I do like medicine. I was always kind of interested in something in that realm, but I also really liked the nutrition piece. And so I went in and I saw, wow, like, there's a fair amount that NDs can do, at least here in BC. There's the nutrition counseling portion. They can prescribe medications. There's, physical therapies and whatnot as well, depending on your area of focus. And that's what first sort of opened my eyes to, like, I could go this route. I could practice very much like a medical doctor in some sense, but also focus a lot on the nutrition. And from there, I ended up reaching out to the school we have here just outside Vancouver to like shadow for a day essentially. And so I went in, I sat in on some classes, I met a bunch of the students, we started chatting, and that's ultimately what I guess, sent me down that road of going into that field. And so then I think it was the next year after that that I eventually applied, and then the year after that started.
Awesome. We actually have overlapping stories. My bachelor's is in nutrition as well, and it was I went into nutrition because I think there was a few different aspects to it, but I was struggling with my weight, but from an eating disorder perspective. And so it was this interest in figuring out how nutrition worked in our bodies as well. Um, but always had a fascination with biology and medicine and didn't want to go the conventional route personally, just because I had been in that model myself and really struggled with constipation and bloating and SIBO, and had seen the gastroenterologist and like didn't get an answer that I liked. And for me, it was like this idea that the doctors must not know something. Like, there's got to be something else. There has to be another answer. Why don't I feel good even though I'm taking these medications? And that led me down this more alternative pathway where I eventually saw acupuncturist and then finally stumbled upon a naturopathic doctor. And I think what really clicked with me was how much time she spent with me, how much she explained things to me versus the in and out of the more allopathic world where I was left with just questions and not feeling heard. Um, and that's where I decided, okay, this is what I want to do because I want to help people find solutions. But it's funny because my journey kind of came full circle because I still had GI issues after working with that person. So like that didn't get fixed. And then I found functional medicine, IFM, and did all of that training. And it's funny when you go through these things, sometimes it gets more complicated and more complicated, and they're like throwing pathways at you and this and that. And I'm like, oh my gosh. And finally, I came out the other side, which is what it feels like. Like emerging from a tunnel, and really realized that the piece that I personally was missing in my health was that I had undiagnosed anxiety that was never being treated, was never diagnosed, was never talked about. And I personally didn't know that that's what was going on that was really contributing to these GI issues. Um, and so I laugh because it wasn't the whole naturopathic medicine thing. Like, it wasn't this, oh, they don't know the answers kind of thing. It was just that nobody picked up on or was able to tell me, like, hey, I think that you should probably go see a psychologist or psychiatrist or therapist and work on the anxiety, and your gut actually may get better. And so for me, it was like this roundabout way to figure out, okay, I still love naturopathic medicine in that I think that we should be using lifestyle medicine first, like, or just in conjunction. Like, sometimes it's at the same time, but lifestyle medicine should be a part of virtually everybody's care in terms of talking about nutrition and exercise and stress management. And I think naturopathic doctors do a really great job at that. And I think that pharmacology is still a huge piece of the picture for a lot of people. And really, at this point, my whole ethos is to be as evidence-based as possible and use the information that we have, and not to discriminate natural versus pharmaceutical, that kind of thing. And that's what I wanted to talk to you about today.
And I 100% agree. I think there's certainly people that go into this field with the idea that, natural is best, or whatever version of that you want to throw out there. But then, especially the last few years, the people I'm seeing coming in are very much more interested in incorporating medicine, and not just making it this black or white sort of thing. So I think we are seeing a shift, and I'm really happy to see that, and hopefully we see more over time.
Yeah. Yeah. And let's jump into that because I wanted to go over it. But this whole idea of the nature fallacy, which is when something that's natural is considered good versus something that is not natural or synthetic is considered bad. What are your general thoughts about it?
Yeah, I mean, so it's called the appeal to nature fallacy, and there's really no good, I guess, basis for that sort of thinking, or rather, it sort of crumbles when you give certain examples. We can talk about foxglove. You start eating that, you're going to have some problems. You go into the forest and pick whatever berries you see, you might have some problems. You eat certain types of animals, certain types of toads or frogs or whatever, again, you've got problems. So there's just because something's natural doesn't mean it's healthy or safe. And just because something's medicinal doesn't mean that it's harmful, or say synthetic doesn't mean it's harmful. There are cases where something synthetic could be better than something that's natural. For example, if we put aside those like toxic examples I gave, and just think about things that people actually consume, we could take steak. And if you're having a steak every day, that will likely increase your risk of cardiovascular disease, certain types of cancers, and so on. But if you're having something like even say plant-based meat alternatives, which get a bad rap, they tend to improve cardiovascular risk profiles compared to the meat, and they're synthetic or manufactured, I guess, whatever you want to use. So there are like real world examples of this as well that we can point to that aren't just isolated to like the toxic stuff, that are the more obvious examples.
Yeah, and I think it's funny because the population that usually talks about we should just do natural, like synthetics are bad, they're usually totally fine with taking things like creatine and whey protein, which there's no creatine tree out there, right? Like we are making creatine, it's a
Hmm.
synthetic.
Yeah.
Same with whey protein. So there's all these places where these things really break down, and people are okay with having their biases and kind of choosing when to apply it and when they're like, no, I'm not going to apply it to this one.
Oh, you do it. They do it all the time. You look at like a lot of the carnivores out there on social media. They'll say all epidemiology or all nutritional research is trash, and then they cite the ones that they think support their bias. Like, okay, well, which is it? Are they all trash, or are some of them good? And if so, why? So you see these double standards all the time.
Yeah, you're really great at pointing those out on social media too, and those are some of my favorite reels that you do, so thank you for that.
I got a funny one coming tomorrow, I think. But anyways, I think it'll be out long before this is out, so it'll already be out there.
Okay, good. Why do you think there's a lot of things in the integrative space that are not evidence based, or do you not think that?
No, I think there are plenty of things in our field that are not evidence based that I push back on my colleagues about sometimes, and maybe they don't like it. But I gotta tell it like it is. Um, I I don't know. I wonder. I think a part of it is this attractiveness of like having solutions to things that we don't really have solutions to yet. So, for example, gut health. We know nothing, okay? Let's just make that clear. We know very little about like the gut microbiome, how it impacts our health, if it impacts our health, beyond just the gut. Um, Yet you'll have all of these like five, six, $700 tests that you can run to like diagnose certain things that we like don't even know if they matter yet. Um, and but if somebody like yourself who was going through that period of having gut problems, you've you've tested for celiac, inflammatory bowel diseases, you've done thyroid, etc. You've run the basic sort of panel that you would typically do in that case, and let's say you're not getting answers, you still want answers. And so then you're going to seek out alternatives. And if somebody comes to you promising, hey, we can give you answers here, look at this comprehensive panel that looks at like 200 metabolites, and we'll be able to pinpoint what mechanisms affected, as if we have any ability to do that accurately, then you might be kind of, I don't know if suckered in is the right word, because I don't go so far as to say that I think people are doing this intentionally, like misleading intentionally. I think a lot of people really do believe it, but it's just it is ultimately misleading, even if unintentional, because I don't think the evidence is there, and I think we need to hold a high standard of evidence, because if not, we're often just shooting in the dark, or again, selling stuff that costs several hundreds of dollars to people who maybe can't even afford it.
Yeah, I think you're spot on, and that's what I think too. And I don't think people, I think for the majority of people are really well intentioned.
Hmm.
And so I don't think it's out of like this desire to trick people or anything like that. I do think that it's just like a lack of education, a lack of awareness, a lack of like doing the research in it or whatever it is. But I totally agree. One of the things I do the most is treat people for chronic GI issues because of my history. And so whenever I'm on podcasts, they're like, okay, tell us about the stool test. And I say exactly what you said, which is they're trash. Like they're
Yeah.
absolutely, unless we're talking about running through like LabCorp Quest where you're looking for Giardia in the stool or something that's
Yeah.
like a tried and true test that's validated. But when we're talking about these comprehensive stool analysis, I won't even go into it because I've talked about it on podcasts at length, but we have no idea how the gut microbiome works at this point in terms of who's actually bad, who's actually good, in what ratio. And I could go on and on, but I think you're in the exact right area where it's like people just want answers and practitioners want to give them those answers, which I get it. I was there. And we can't give answers to things that we don't know the answers to at this point.
Yeah, and like on the topic of gut health, I just feel like I should preface this a little bit because I think some people might push back on some of the things that we're saying. It is true that you'll see in the observational research, you'll see correlations between certain types of microbes or certain microbial makeup and other outcomes. However, why is the gut that way on average? Well, on average, people who eat more fruits, veggies, whole grains, etc., are going to have a certain type of microbiome with some individual variability. And then people who eat more of the like red meat and pastries and sodas are going to have a different type of microbiome. And that, again, red meat pastry diet is going to be associated with cardiovascular disease, with diabetes, etc., and the fruit, veggie, whole grain diet is going to be associated with better outcomes. We can't say it's because of the microbial makeup. There are many other things going on. I mean, we know that those foods affect our LDL cholesterol levels. We know that they can affect liver fat accumulation. They can affect all sorts of things. So we can explain it through these other mechanisms. And then if we look at what are called Mendelian randomization studies, where they look at people who genetically produce more of certain compounds or less of others, we see that the compounds that are associated with our gut microbiome have very little impact on our health. And so even if we were to accept that, yes, these mechanisms might be in place, they don't seem to really matter much. And if they do, it's to a moderate degree. So that just further solidifies why I suggest that I don't think we know that much. And that's not to say that there's no impact. It's just we don't know what that is at this point. And if there is, it's probably modest.
Yeah. And the other thing I mention when I talk about this too is that it doesn't mean this is going to be forever. I think we're going to get to a place where we know a ton more about the gut microbiome, and maybe we can have targeted therapies to increase or decrease certain bacterial strains. But as you just said, like we're just not there yet.
Mhm.
Okay, what's another wellness trend that frustrates you because it's completely unsupported by the data?
It sort of falls into the whole appeal to nature thing, but the seed oil fear, I would say, is the
Yes,
big
let's
one. Like that's
go.
like the biggest one there. It's the one thing that like every diet camp agrees on. You can ask anybody. You can ask the Whole Foods plant-based community. You can ask the carnivore community, the keto, the Atkins, whatever you want to choose. They're all going to say that seed oils are harmful. Yet the research, both randomized controlled trials and observational studies, and actually within the observational studies, not just those looking at dietary intake, but actually blood levels. So you can measure the amounts of certain fats in the blood so you're not relying on what people report consuming. And across the board, we see benefit for the or a benefit if you're replacing saturated fats with these seed oils or unsaturated fats from seed oils. So it's incredibly consistent. And actually, not even just if we measure in the blood, I should mention if you measure in fat tissue as well, which is an even more reliable marker, we see benefits. It's one of those things that because it's produced in a factory or because it maybe wasn't consumed for as long as animal fats have been or whatever, people want to vilify it. But at the end of the day, the health outcome data is the health outcome data. We see very consistently benefits for cardiovascular disease, for mortality, for even liver fat accumulation. And so it's one of those things that people could actually probably benefit from consuming more of if in place of saturated fats.
Yeah, substituting. So saying like if
Yeah.
you're going to have butter or ghee or something saturated, if you're substituting it for a seed oil, your health outcomes are going to be better in terms of cardiovascular disease and the other things that you mentioned.
Mhm.
Why do you think people say, but it's inflammatory?
Because of the omega-6 content. So the omega-6 fat linoleic acid is prevalent in these seed oils. And to clarify for people what I'm referring to, seed oils would include sunflower, safflower, corn oil, cottonseed oil, canola oil, even though it's slightly different in its fat profile. It actually has more omega-3s, the canola versus some of the other ones. But but they contain a lot of this linoleic acid. And theoretically, that linoleic acid could be converted into another omega 6 called arachidonic acid in our bodies, which could then theoretically be pro inflammatory. And so it's all theoretical. They'll say that A leads to B leads to C. However, the beauty is we can test that. And we have run multiple, not we as in me partaking, but humans have run multiple randomized controlled trials on human subjects where they feed them these seed oils and they do not increase markers of inflammation. And that's an
Can you
incredibly
say that one
consistent
more
finding.
time?
Yeah. So we have numerous randomized controlled trials where they will feed seed oils to humans and they do not increase markers of inflammation. And so, um, like when people tell me that, I ask them to cite something and they simply can't. Now, there is one study they could sort of cherry pick if they wanted to, where they didn't even use your standard markers of inflammation. There were some more adjacent markers that they looked at, but let's grant it for a second. They put seed oils through 20 rounds of heating, like frying and cooling. So they just repeatedly fried and cooled, fried and cooled. I can't remember the exact time for each cycle, but that's extensive. And then in certain subjects, not across the board, I believe it was in subjects with obesity, but I can't recall exactly that there was a certain subset of the population. There was an increase in like one or two of the markers. That's it. If you're using it for normal like stir frying, if you're using it on salads or basically anything else, we don't see that sort of an effect. If anything, you see a reduction in inflammation or no real change at all.
Fascinating. Do you know in that study, did they start with just one round of heating and cooling and then that didn't do it, so they kept doing it, or was their
No,
original
they
protocol?
did. Yeah, they did it from the gate.
Okay.
They put it through those cycles. They basically they wanted to see if they could like damage the oil to a point that it causes problems. And even then, it was only in. Oh, you know what? I think I remember. It wasn't in individuals with obesity. I think it was with coronary artery disease.
Hmm.
So those with pre-existing cardiovascular disease, they did see a rise in a couple markers, and people without, they didn't, or something like that.
Hmm.
But
Hmm.
yeah, I can always send it to you for people to double check because I might be slightly off on some of those details just from memory.
Yeah, really interesting though. But otherwise, the research is pretty clear in terms of if you substitute, we see lower rates of cardiovascular disease in people who eat less saturated fat, more unsaturated fats.
Yeah, and I would actually to that point, I would say let's say theoretically that if you consumed a meal of these oils in that context that we just talked about, and it temporarily shot up a couple of markers of inflammation, if at the end of the day it still lowered your risk of cardiovascular disease, who cares? Or mortality, who cares? It's like I use exercise as an example all the time because exercise causes inflammation. If you go out and exercise hard, you're going to be in an inflammatory state. You're going to have an increase in markers of inflammation, which then fall back down within a day or two. And it's actually a good thing because at the end of the day, exercise lowers your risk of these outcomes. And so we can't just focus in on like these very short term changes in certain markers. It just doesn't pan out a lot of the time.
It's a great example. I had a patient yesterday where their labs came back, their liver enzymes were high, their CRP was high, and I was like, "Any chance you did a really hard workout right before this blood draw?" They're like, "Yeah." I'm like, "Okay, we can't do that next time." But if you look at the blood right after a really strenuous bout of activity, it can look not good, but it doesn't mean exercise is not good for you.
Yeah, yeah, and it can last a while. Like you can exercise hard and have some of these markers off for up to like 2 days.
Mhm.
Like it's not even like an hour or two. It can last a while.
Where do you think the majority of this misinformation on social media is coming from?
Um, it depends. I think it depends a lot on the topic. So if we look at like a lot of the soy fear mongering, or potentially to a degree the seed oil stuff, or certainly the plant protein stuff. I mean, I think a lot of it is fueled by industry to a degree, and then you have a lot of these people in the carnivore space who are really profiting off of what they're promoting as well, and so there are some of those financial motives. I think it's also the fact that a lot of these explanations are just very simple. Like, for example, oh, it has omega-6, so it's inflammatory. Or, oh, soy has estrogen, even though it doesn't. Has estrogen, and therefore it's feminizing. Or, like, it's just such a simple explanation that people can repeat. And I see people repeating it all the time. And then I usually play these games with some of the commenters where I'll just, like, question them on what they're saying. Like, oh, based on what? Or what, what receptor does that bind to? Or just to kind of showcase that, hey, maybe you haven't investigated this to the degree that you probably should before making these claims. And so I think that's a part of it, is just they're really, really simple things to explain or to repeat. And on the surface, they might even make sense. But then when you kind of dive into the specifics, it sort of falls apart.
Do you think group mentality has anything to do with it?
Oh yeah, yeah, definitely. When you think about like the meat and masculinity stuff, especially that goes back to bodybuilding through the '80s, and Schwarzenegger and all of that, and it's just it persists to this day. Like that same ideology still persists today, and you see it repeated by certain people in the like online YouTube kind of. I don't know, they call it manosphere or whatever space. It comes up all the time. It's sort of a part of the culture now, almost.
I haven't heard of the term meat and masculinity. Is that what you said?
Yeah. Oh, you actually haven't.
No, go
Wow.
explain. I mean, I think I know what you're going to
Oh,
say, where it's like, is eating meat like make you more of a man? That's kind of the idea
yeah.
behind it.
Yeah. I'm actually really shocked. You're one of the first people I think I've ever heard who hadn't heard of that. So yeah, like there used to be ads, and these ads weren't just like back in the '80s. They ran through the '90s into the 2000s. There's one actually that was even I think a few years ago. I can't remember which company did it, but a lot of like meat companies, fast food companies, etc. They'd run ads around like real men eat meat, and like that sort of messaging. And then you had bodybuilders promoting a lot of this stuff, and it's very much. It's actually very much tied to the term soy boy, which you hear a lot. So that's sort of where a part of it comes from. It's like if you're a masculine man, you eat meat. If you're a feminine man, you eat soy, or that sort of thing. Um, so I'm shocked that you hadn't heard that.
Well, so I feel it in culture where I've heard,
Yeah,
I hear people like talk about, oh, you got to have your steak or, in that voice too, where you're
yeah.
like, what are we doing? Um, but I didn't know that there was actually advertisements
Oh
around it,
yeah,
which makes sense.
yeah,
That
I think the famous one was Wendy's. I
okay.
think as one of the fast food chains. I think it was Wendy's. I think if you were to look it up on YouTube, you'd probably see it. But they were one of the like first big ones, I think.
This is going to be a YouTube rabbit hole for me coming up,
Yeah.
so I'm excited for it. Anything for women? Like, were they marketing like,
I feel like not really. Honestly, I see that more now. I see more women pushing the like high meat, high
yeah,
protein stuff
protein?
nowadays than before, and that's because protein has almost now not just for muscle and whatnot, but it's been sort of tied to almost like longevity
Mm-hmm.
or healthy aging and maintaining muscle with age and whether the evidence supports that or not, I guess we can get into it. I think for animal protein sources, especially red meat, not so much. But for like plant protein sources or certain animal protein sources, yes, very much so. So it sort of depends on the source there.
Yeah.
But it's definitely shifting now.
How many grams per kilogram body weight do you recommend your patients get for optimization, not just like
Yeah,
RDA?
yeah. So for just someone looking to be healthy, age healthfully, put on some muscle, perhaps 1.2 grams per kilogram of body weight is a really good target for the vast majority of people when we're talking bone health, reduced risk of frailty, etc. But if we're looking to just squeeze out every ounce of gains you can, then I go a bit higher, 1.6 grams per kilogram of body weight. Beyond that, doesn't seem to really matter unless you're cutting weight. So, if you're dropping your caloric intake on purpose to try to drop some fat, then you might want to bump up protein even more just to help preserve some of that muscle mass. But that's an exception.
Yeah. And those are the exact numbers that I give my patients. I sometimes will shoot their target if you're listening and you're my patient. Earmuffs right now, but sometimes I'll put their target a little bit higher than because I know that they might not meet it.
Safety,
So
yeah,
yeah,
safety net.
sometimes there's a little bit of a buffer, but yeah, absolutely, I agree with that. And any other misinformation things that you think we need to dispel these? Some of your favorites?
I mean, we touched on soy there. I don't know if you want to go into more detail on it.
No,
I'd say
let's do it. So some people will
okay.
say, I don't want to eat any soy. I'm a man. It's going to give me gynecomastia, which is like breast
Yeah.
tissue.
Yeah, yeah. So, for starters, where the concerns largely come from is one, the fact that these soy products, they do contain isoflavones, or better known as phytoestrogens, which are not estrogen, but they have some structural similarities, so they can interact with estrogen receptors in our bodies. Um, Now, you feed really high amounts or inject high amounts into rodents, then they end up with problems. A couple problems with that, though, is that we aren't rodents and we don't consume that amount, or we don't get them in that concentration. Now, there is a case study, there's actually a couple case studies of men that were consuming ridiculous amounts. The exact numbers, I can't recall, it was somewhere like 12 to 20 servings a day of soy. And one of them experienced a bit of breast tissue growth, and then the other one, I think, was struggling with erectile dysfunction. In both cases, and they make this very clear in the papers, but that doesn't stop people from misquoting them. They can't even draw it necessarily to the soy. It's speculative. These are individual case studies. But if so, it's a ridiculous amount that nobody's recommending. Now, we have a meta-analysis of randomized controlled trials by Reed and colleagues published, it was around the end of 2019, early 2020, that looked at 41 clinical trials, and across the board, there were no significant impacts on hormone levels, whether it's testosterone or estrogen. Now, in women, there's a few meta-analyses now. The most recent one is the one that I like to cite the most. This was just published end of 2024, beginning of 2025, somewhere in there. And they looked at estrogen levels, testosterone levels, but also measures of estrogenicity. So they actually looked at studies that measured like uterine lining thickness, for example, or menstrual cycle length and these markers. And there was nothing of concern, again, across the board. So we have really good data now, up to several servings, even like 5 servings a day of soy consumption in these clinical trials that do not demonstrate harm with regard to hormones. In fact, if we look at long-term cohort studies, we see that higher soy consumption actually is associated with a lower risk of breast cancer, a lower risk of prostate cancer, lower risk of cardiovascular disease. And the breast cancer note is often sort of confusing to people, and that's because these phytoestrogens, they specifically bind to certain types of estrogen receptors. These are called ER beta or estrogen receptor beta. And in breast tissue, those have anti-estrogenic effects. And so you're actually doing the opposite of what estrogen would do in breast tissue, yet people are concerned about the estrogenic effects. And so that's why, or very likely why, the soy seems to protect against breast cancer. And this is recognized by the American Cancer Society, by the Canadian Cancer Society, and many other bodies across the world.
Yeah, really important. I mean, this is why I love what you do on social media, where if somebody is avoiding soy because or avoiding seed oils, right, because they think they're going to be harmful to their health, when in reality, you actually may be getting some health benefits from
Mm-hmm.
consuming or swapping some of the things that you're eating for these things. So thank you for that. We touched on this a little bit already in terms of, I call them eclectic lab tests. These are tests that are not FDA approved. The comprehensive stool analysis that looked at the gut microbiome falls into this category of tests. But we're talking about tests that you're not going to go to LabCorp to get this. You're not going to go to Quest Diagnostics. It's not an FDA approved, validated test. Things like a 4-point cortisol test. That's kind of an interesting example. There's the urine hormone test. What are your thoughts on these in general?
I mean, if there is clinical utility for them, I would leave that up to like an endocrinologist to sort of determine. I'd stay within my realm of expertise. Obviously, just a single morning cortisol is something that could be run in certain cases. Like there are certain, I don't know, kind of like versions of those tests that could be done as like an additional or an initial screening. But then if you need more like specialized tests for any reason, or if there is validity to them, I would leave that up to an endo to decide if they're, again, hormone related. That's just outside my realm of expertise.
Yeah, yeah. And I'm kind of getting at this point of like in the integrative space or functional medicine, however people want to brand themselves, there's this pocket of testing that's being done, and it's not little. Like you said before, like some of these tests are hundreds and hundreds of dollars, and they're usually going to be kits that are shipped to a person's house. They're collecting, they're sending them back.
Mhm.
But I think it's just another part of this space that I personally think devalues the space, where I think that we can, because I think something that you said before is people just want answers. So they're looking for additional things to give them answers. And if you do a million tests, the likelihood of you getting an answer, whether it's the answer or not, but just like things that come back as positive or out of range are pretty high, right? In terms of if you test 100 markers, the chances of
Oh
one or
yeah.
more of them being out of range are going to go up and up the more things that you test. And so my whole thing about this is number one, I think that we are way over testing in the integrative space at large to the point where you don't know if the thing that's coming back that's positive is the cause of the actual condition that you're looking to help somebody with. And the amount of money people are spending on these tests and then like all the supplements or things that they're getting for treatment around them is enormous. And I feel like people are getting really, um, I don't know how to say this in a PC way, but they can be led down the wrong path that can lead them to think that they have an answer and get excited about it and maybe even feel a little bit better after treatment, which I've seen, but it doesn't last. And then
Hmm.
things come back and then they're right back where they started, but they're $1,000 behind.
Yeah, and that's sort of like you can even chalk that up. Not saying in every case, but in many cases to placebo effect, right? Like that short-term
100%.
benefit, expecting a benefit, you get a benefit, or nocebo effect on the other hand. And I think this plays into a degree with some people who I don't know about you. I'm a vegan anyway for listeners, but like a lot of people in the sort of ex-vegan space, I think a lot of the time it's like you're being hammered with messaging about how veganism is terrible for you all the time, and or a vegan diet is terrible for you, and I think a part of that plays into sort of expecting, oh, my gut feels a little off. It must be the diet. It sort of leads you down that thinking. Now, with this over testing or treating stuff maybe in a way that isn't super beneficial, I think something that really compounds that issue is you have people in this complementary or integrative space who sort of promote a single answer to everything. So
Hmm.
you'll have someone who's like, they'll call themselves like the oxalate specialist, or whatever term, whatever area that they're supposedly experts in, and everything is caused by that. Whether it's cardiovascular disease, whether it's diabetes, whether it's cancer, whether it's the gut problems, whether it's your hair falling out, it's all because of this issue. And then they'll sell that, they'll sell some type of testing around that, and then they'll sell their treatments for that, oftentimes. And yeah, that's probably not. I mean, for one, the oxalate stuff is largely nonsense. There's a nugget of truth, but that sort of messaging applies across the board to many people who sort of base their entire treatment around like one specific thing that apparently is causing everything.
The cortisol people. Like
Yeah,
everything is because
yeah,
of high
yeah,
cortisol, right?
yeah,
Weight gain, um, puffy face, like anything is because of cortisol.
yeah. You got Gundry with the lectin stuff, and like I mean, it's on and on and on.
Yeah, yeah, totally agree. All right. I want to know your thoughts on supplements. So when you're looking at, should I give the supplement to my patient or to myself? How are you evaluating it? How are you telling, is it too early to give something that's coming out? Maybe there's rodent data on it, but not human data. Kind of, how do you go through that?
Yeah, I mean, for nutritional supplements, maybe it's just my experience at this point with that I find it pretty simple. Like I'll review someone's diet, I'll review if they are taking any current supplements, and if not, certain dietary patterns warrant certain types of supplements. B12 for vegans, it's like a no-brainer. You're gonna take a B12. Like that's gonna be a recommendation. Um, calcium could potentially be an issue for women, especially elderly women who maybe aren't consuming fortified milks or dairy. Like I can make those judgment calls just based on the reported intakes. As far as supplements to treat a specific ailment outside of just the nutritional supplements, yeah, like I will want to make sure, like, do we have human data on this? If we simply have animal data, I will pretty much never be suggesting that. Or if somebody asks me about it and they want to try something, I'll say, look, we don't have human data. We don't know about risk. We don't know if it'll work, etc. If they then take that information and go and do it, I can't stop them. But if we have some, I think an interesting area is actually with migraines. We have some clinical trials, randomized controlled trials on a few different supplements, the certain types of magnesium, CoQ10, B2. B2 probably has some of the strongest evidence there, but it's still not like, a 5,000 person randomized controlled trial conducted over 6 months. Like we don't have something like that, but we have a number of smaller trials that suggest, hey, there might be benefit with this particular supplement at these doses. The risks are very low. I'll explain what they may be. And then the patient can ultimately decide if that's something that they want to try for a few months and see if it makes a difference. And if it does, great. If it doesn't, then we don't need to keep doing it. But that's sort of how I'll approach it. Is there's sort of a threshold of like at least having some human data before I'm going to make a suggestion around something. And then even so, If it's like one pilot study, probably not going to. If we have a number of studies, even if they're smaller, I will inform the patient of that, let them know this is kind of where the evidence is at, and then they can make a decision.
Yeah, I love it. And right in line with how I work as well. I think it's interesting because right now there's a bunch of supplements that are being talked about in the social media space, with virtually just rodent data around them. So I want to pick your brain about those if we have time. But I really want to talk about nutrition a little bit more. This is like your bread and butter. You just said you're vegan. I'm guessing that's because you believe it has the most robust evidence to support it in health. Can you talk a little bit about that? And if somebody is coming to you and they just say, I want to live the longest and the healthiest, what do you recommend for me? I don't have any personal preference on my diet.
Yeah, so I'm vegan for ethical reasons. That's why I go. That's ultimately what veganism is. It's an ethical position. However, I am plant-based for health reasons. Now that doesn't need to be 100%, right? So that's the difference between why I go 100% versus like 90%. Ultimately, the data on like the foundations of a healthy diet being again whole grains, fruits, veggies, nuts and seeds, legumes. If you're having animal protein, seafood or fish, that data is very, very clear. Now, where you fill in the edges is where you have some flexibility. You can incorporate a little bit of meat here and there once or twice a week or something. You can incorporate certain dairy products, especially fermented or low-fat dairy. Fish, as I mentioned, is another animal protein source. Those can all factor in, and you can have some hyper palatable, salty, sugary, ultra processed foods here and there. Like that's fine to fill in those edges, but just not as a every meal, every day type of thing. It's what you do, 80%, 90% of the time that really matters. And the filling, so to speak, is just not that important.
Do you know, I'm curious, do you know off the top of your head at what point in terms of like servings per week meat becomes problematic for somebody's health?
Yeah, so where we consistently see risk is a serving a day, and that would be an average of about 3.5, 4 ounces a day, or about 100 grams a day. At that point, it's pretty clear that there are risks with regard to cardiovascular disease, colorectal cancer, and potentially all-cause mortality as well. Now, if you're having it once or so a week, again, not really a big deal. And there's some data suggesting that even twice a week can have a small impact on risk. So is that super meaningful? Maybe not. So I would limit it, generally speaking. Particularly if we're talking about red meat here, I'd limit it to once or twice a week if you're having it, at a standard serving size of that 100 grams, which is like a deck of cards or a palm of your hand. But there's some wiggle room there as well because the dosing in a lot of these studies isn't going to be super accurate. It'll be ballpark,
Mhm.
as far as like sort of guesstimating.
And what about the meat is actually increasing the risk for people?
So saturated fat certainly a big component. Now you can have leaner cuts of meat that are lower in saturated fat. They still have dietary cholesterol, which has a small impact. There's still heme iron. There's still some other compounds in there that we're just learning more about, like new 5GC and so on, that might play a role. But why I think lean meat still potentially carries some risk, at least relative to plant protein sources, is because we actually have what are called substitution analyses, where they'll look at the replacement of red meat for plant protein sources, and you'll find that the plant protein still lowers risk compared to red meat, even if you adjust for saturated
Mm.
fat, fiber, and other types of fats. So that would be like equalizing those variables, yet the plant protein still comes out on top. And that might be due to the polyphenols in the plant protein, some of those other compounds in the animal protein, or at least the source. And actually, the fiber is adjusted for, so the fiber won't necessarily play in there.
That's really interesting. I need to be better about that. I think that's one of my things I'm going to take from this podcast as to how do I substitute some of my animal protein for more plant-based sources. So thanks. If was there something that you used to recommend, whether it was a supplement or anything in health that you have gone back on and you say, actually, I wasn't right about that?
Yeah. Well, for one, I used to be. People always tell me how I'm biased now, apparently, but I used to be kind of against the oils, especially the seed oils. And now it's flipped because I've become informed with the what the evidence actually suggests. So that's one where it's sort of the opposite. It's not like I recommended it before and don't now. I
Hmm.
went the other direction. Another one that I used to like very vehemently advocate for taking that I'm no longer, at least not as strongly, are long chain omega-3 fats, so like EPA and DHA. I actually don't think the evidence is super clear there for otherwise healthy people. Now, for people with certain cardiovascular risk factors or with a history of heart attack, there does seem to potentially be some benefit. In people with early signs of cognitive decline, again, there might be some benefit there. In pregnancy, definitely that's one place that I certainly recommend it. But for otherwise healthy adults, especially, the studies that we have looking at supplementation have not really shown any clear benefit. There are some issues with a lot of the observational studies in that they'll measure omega-3 levels in people and they'll find that they're associated with better health, but they will basically make no diet adjustments. And so why do they have higher omega-3 status? Probably because they're eating more fish and fish eaters tend to eat healthier overall. So is it really the omega-3s that's doing it, or is it the fact that they're eating healthier overall? So there's some real concerns. Ultimately, I would like to see a study done where we actually look at vegans long term, those who do supplement versus those who don't, because you're taking people who get zero exogenous omega-3 or long chain omega-3 intake versus those who are supplementing. And that could be telling, but I'm just not sure that they've been tracking that data yet. So it might still be a while before we get it.
Yeah, really interesting. And I totally agree. I mean, I used to give almost everybody fish oil, including myself, when I was first out of school, and that's really changed for me because of what you said. If you could wave a magic wand in terms of the whole kind of bucket of naturopathic medicine, and you could say, what would the future look like for this profession? Are there any things that you would really desire in terms of us moving towards or away from?
I'd like to see us move more towards, or I'd like to see us have more rigorous standards of practice around like um, whether they're in the form of like clinical practice guidelines or what have you, but having some standard of evidence that we need to meet in order to recommend something. It doesn't have to be exactly the same as, say, the College of Physicians and Surgeons or anything like that, but having something like that that is more rigorous. Um, I would like to see more collaboration with medical doctors as well. So I actually got to I've gotten to work with some medical doctors in the area, I'm trying to think, some oncologists, anesthesiologists, etc., on various projects over the last, say, 4 or 5 years. I've now published some papers at the University of British Columbia with the past chair of endocrinology there, and so I've started to build a lot of these bridges, which I think has been great, not just for me, but for the profession as a whole. And I'd like to see more of that collaboration. And it's because, when I'm working with these individuals or speaking with them, I try to make very clear that like I want to stand by the evidence and that I have an understanding of the literature and so on. And I'd like that to be more, I guess, broad along our or among our profession.
Yeah, I love that. I think it's so important. Where can people find you?
I'm definitely most active on Instagram, but I'm on all social medias, just searching my name. On Instagram, it's at dr.mathewnagra, and similar everywhere else. And then I also have a website, dr.mathewnagra.com, where I'll link episodes that I've been in, like this one, so people can listen to this and past episodes. And then I have an email list there you can sign up for too if you just want to keep up with what I'm doing.
Awesome. And we'll put all that in the show notes. And thank you so much, Matt. It was really nice chatting with you. And I'm glad we finally got to connect now that we're both on social media. I'm going to slide into your DMs more often.
Sounds good. Good to meet you and speak with another ND who I think has similar takes to myself.
Absolutely. All right. Thank you.